Hello, everyone, and welcome to our Form Health webinar. Today's topic is keys for successful weight loss. I'm Dr. Lauren Lemieux, and I'm a physician here at Form Health. I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined by my colleague, registered dietitian Julia Bleecker, who is a registered dietitian at Form Health and a certified specialist in obesity and weight management. Just a few announcements before we get started. Your participation today is completely anonymous, and we do encourage you to ask questions or leave comments using the chat feature in Zoom. And you will be getting an email later with a link to a recording of the webinar, as well as more information about Form Health. So for today, we are going to first start off by talking about the pillars of successful weight loss. We'll then debunk some very common weight loss myths. And then we'll talk a little bit about FDA-approved medications for weight loss. And then finally discuss what our approach to weight loss is at Form Health. So when we ask ourselves, what helps people lose weight and keep it off? There's four main categories that come up. These include nutrition, physical activity, mindset shifts, and support. And support can take many forms, whether it be from family and friends or partnering with healthcare providers with a medical weight loss program. And importantly, there's not just one thing, but rather a combination of these elements that's needed for long-term success. So let's talk about nutrition for a moment. Nutrition is such a crucial foundational part of any weight loss journey, but unfortunately, it's often a source of a lot of confusion for people. Think about your own weight loss experience. How many different diets have you tried? How many books are out there that tout that they have the perfect diet for weight loss? Well, I'm going to tell you the truth. There is no perfect diet for weight loss. Studies have shown consistently that it's not so much the portion of carbohydrates or fat or protein that matters for long-term weight loss success. Another myth is that it's all about calories in and calories out. And if that were true, then 100 calories of jelly beans would be the same as 100 calories of tomatoes. But we all know that possibly can't be true. Your body processes these foods differently. And that's why it is so important to consider the quality of the foods we are choosing when we're trying to lose weight. For example, processed foods like cookies, crackers, chips, juice, these have all been shown to cause weight gain, raise our blood sugar levels, and increase cravings. We can literally spend an entire webinar just talking about the effects of these foods on our body and our weight. And so really the bottom line when it comes to nutrition for weight loss is to understand and appreciate that each person is unique. So different eating patterns may work well for some and not for others. But what studies consistently show is that what really matters is whether or not you can stick with it in the long term. When it comes to successful weight loss and physical activity, I think it's important to understand that all activity counts. You don't have to go to a gym or run 5 miles or use fancy equipment to be active. Now, studies have shown, though, for weight loss, there's a combination that works best in that we include both aerobic or cardio exercise and resistance or strength exercises. So what's the difference? Cardio is something that gets our heart rate up, gets our breathing up, helps us burn calories and improve endurance. Whereas strength training is really targeting muscle building and not just building muscle, but preventing the loss of lean muscle when we're losing weight. Keep in mind, muscle, it turns out, accounts for 70% of our resting metabolic rate. Those are the calories that we burn at rest. So the bottom line is the more muscle we have, the more calories we burn. Furthermore, it's very common to lose muscle as we get older. And so if we haven't made physical activity a regular part of our routine, I do want to let you know the good thing is it's never too late to start. Though I do think it is important that while physical activity is very important for your health, most people are not going to be able to lose a significant amount of weight with just the exercise alone. And studies have shown that the maximum expected weight loss with just exercise alone ranges from 0 to 3%, meaning people will most likely maintain their weight, maybe lose up to about 3%. But where you really see more significant weight loss is that combination of the activity plus the nutritional changes, a low calorie diet. And that's where we see closer to 5 to 15% body weight loss. And from a medical perspective, with even just as little as 5% body weight loss, we can see significant improvements in things like blood pressure and blood sugar levels. And so this is all to just say that if exercise is something that you're really struggling to add to your routine, it's definitely not the end all be all for weight loss success, but it's still an important component. Now, one of the ways to help us maintain the behavior changes we're making to lose weight is to make sure that we have the mindset that's compatible with success. And one of these mindsets is understanding that weight loss is a marathon, not a sprint. Restricting yourself for a couple weeks to lose a few pounds is not sustainable, and the weight typically comes back when you go back to your usual routine. And so that's why we emphasize the importance of long-term lifestyle changes. Let's talk about the all or nothing mindset. An example of this thinking is, I have to eat only healthy food, or what I always hear, I have to eat clean. And if I don't, like if I have a cookie, I have failed. The reality is we are all human. None of us is perfect. And expecting yourself to be perfect is really a setup for failure. Now, remember, there's no single food or day or meal that defines your weight or your success. It's very important that we create balance when making our lifestyle changes and really reflect, is the expectation I'm setting for myself realistic? Now, I also think it's so important that we understand that it's not just about a number on a scale. Think about other changes you're observing during your weight loss journey. Are your clothes fitting more differently? Are you able to keep up with your kids at the playground? Can you more comfortably sit and stand? These are all things that we call non-scale victories and are extremely important to keep in mind, because the minute the scale stops moving in the right direction is when many people decide to stop. And so I like to use this picture here on the right to think about what's actually happening when we're at, let's say, a weight loss plateau. So it can feel like we're going in circles and not really making progress. But in reality, we are developing skills and resilience for the next time you're faced with an obstacle. Because let's face it, obstacles are going to keep coming up. And you're learning and growing from this experience. It's also a wonderful opportunity for self-reflection. Am I doing something differently now that I wasn't doing before? Or what was I doing when things were working well? We talked a little bit about weight loss plateaus at our last webinar, Overcoming Obstacles to Weight Loss. So I encourage you to check that one out. We'll also include a link in the chat for you to check out. And so finally, let's talk about support. So studies have shown that people tend to be more successful when they have other people in their lives involved in their weight loss efforts. So if you feel comfortable, think about discussing your plans with your friends and family and why weight loss is important to you. You may even want to partner with someone who has similar goals. You could also consider working with a team to help support your needs, such as a medical weight loss program. And this study illustrates just how important a team support can be. So what this study looked at is, in the first 4 months, patients were involved in a weight loss program with regular support visits. And after the 4-month mark, the goal switched to weight loss maintenance. Now, as part of the weight loss maintenance, one group continued to have follow-up where they had support visits and check-ins. And you can see here in this orange line, they're actually continuing to lose weight. And then the weight does come back a little bit, but settling out. And they're essentially able to maintain a significant amount of weight loss over time. This is up to about 15 months. Contrast that with the group in the dark blue line, where after the 4-month mark, they're no longer having these maintenance follow-up visits. Their weight really starts to come back. So again, this illustrates not only the importance of support for short-term weight loss, but also for long-term weight loss maintenance. Now, I want to acknowledge that there are situations where lifestyle changes are optimized to the best extent possible a patient can, and yet they're still really struggling to lose weight despite this. And there may be a number of reasons why this is the case. Now, this is a very simplistic drawing, but I like it because it can illustrate how this is almost like a tug of war with yourself. It feels like something's pushing you back to the weight you once were. And the reality is, there are physiologic changes in our body that occur. Our metabolism slows down. Hormones that increase our hunger and decrease our fullness are affected, and essentially keep us from losing too much weight. So when lifestyle changes on your own are not quite enough, that's where working with a team who's experienced in medical weight loss can be extremely helpful. This may also be a situation where we might consider including weight loss medications as a support for the weight loss efforts. This is a list of the current FDA-approved medications for weight loss in the United States. And I definitely encourage you to check out our previous webinar, Medications as a Tool for Successful Weight Loss, for even more in-depth discussion of these medications. But to briefly review, the current FDA-approved medications include GLP-1 receptor agonists. These are liraglutide or Saxenda, semaglutide or Wegovy, naltrexone bupropion, also known as Contrave, phentermine, which goes by a couple names, Adipex P or Lomera are two common ones, phentermine topiramate or Qsymia, orlistat, which is Xenical by prescription or Ally over the counter, and Plenity. And you'll notice some asterisks here. The asterisk of phentermine is indicating that this is a controlled substance, so it's not prescribed by doctors at Form Health. And Plenity is technically classified by the FDA as a medical device, not as a medication, because it's not absorbed by the body. Now, who is considered a candidate for weight loss medication? I first and foremost want to highlight that this is undertaken with a very thoughtful discussion between you and your medical provider, your doctor, as well as considering your own medical history. In general, the FDA criteria are that it's for a person who has a body mass index of 30 or higher, or 27 or higher, with a weight-related medical problem like diabetes, high cholesterol, heart disease. And if you're not quite sure what your body mass index is, there's a number of free online calculators that you can use where essentially you just enter your height and weight and it will give you this number. I also want to emphasize that medication is really used in addition to the diet and lifestyle changes, not instead of. And I think this is highlighted really nicely in this study here, where you had 4 different groups. You have patients who were given only a medication for weight loss, people who were involved only in intensive lifestyle counseling, or people who had a combination of the two, medication and brief lifestyle counseling, or medication and intensive lifestyle counseling. And all of the people in these groups were losing weight, but you may be surprised to see that with just medication alone in this instance, they actually lost the least amount of weight. People who had intensive lifestyle counseling and no medication actually lost more than people with medication alone. However, the study does highlight how a combination of medication and lifestyle counseling, especially more intensive lifestyle counseling, can really maximize weight loss at 1 year. So how do these medications work is a question I commonly get asked. In general, most of them work by decreasing appetite and cravings. The GLP-1 receptor agonists specifically have the added effect of slowing digestion, and that can help people feel more full. Orlistat specifically blocks fat absorption, so it doesn't affect appetite. It effectively is decreasing the total number of calories that you can absorb from fat from the diet. And Plenity works by physically occupying space in the stomach so you feel more full. But I think it's equally important to understand what they don't do. So weight loss medications do not significantly rev up metabolism where now you're burning an extra 500 calories a day. They don't replace a healthy diet and physical activity, nor do they address underlying life stressors, and they do not work for everyone. Additionally, I think it is extremely important to be aware that there is the potential for weight regain after stopping medications. And this has been demonstrated in the studies of these different weight loss medications, I'm showing you one study here of a medication called semaglutide. In this case, it's Wegovy. And you can see here at the beginning of the study, up to week 20, everyone was on this medication, semaglutide, and their weight is going down in this orange line here. At week 20, they divided the groups into two, where one group continued taking the medication, and that's that dark blue line here, and they're continuing to lose weight. The other group was actually switched to a placebo. So this is something that has no therapeutic effect. And they started actually regaining weight, and that's demonstrated in this gray line here. So again, very important to keep this in mind. So what is it like to work with us at Form Health? You are partnered with a physician who's board certified in obesity medicine and an experienced registered dietitian to come up with a plan that best suits your individual needs, because no two person is alike. We provide personalized guidance in terms of nutrition, physical activity, mindset shifts, and if appropriate, medications, not just to help people lose weight, but to maintain the weight that they do lose and really live their healthiest lives. Form Health is unique in that everything is done entirely virtually. So you get to join your visits with your doctor and your dietitian on your phone. You can do it from the comfort of your home. And you can also utilize our app to track your weights, to take pictures of the food you're eating, and even chat with your team. And I want to highlight that in terms of support, you're meeting with a registered dietitian approximately every 2 weeks and your physician or doctor every month, which is an exceptional level of support. And if you have more questions about our program, feel free to write them in the chat and we'll do our best to answer them. So I want to thank you all so much for joining us today. Julia is going to hop back in here so we can answer some of the questions that you guys have been asking. And in the meantime, I do want to point you to our website, www.formhealth.co, if you want to take a look and see more information there. All right, Julia, so what questions do we have?
Excellent. Yeah. So a couple of questions that have just started coming in. Someone asks the question of if there's any thoughts on your end, Dr. Lemieux, in terms of where people gain their weight. So in particular, they're asking about like in the stomach area, but I know everyone feels, they might be a certain area in their body that they're gaining weight. So we'd love your thoughts on that.
That is such a great question. So there's actually a lot of research that goes into understanding how and where we deposit fat. And so there's two major categories you can think of. There's one that's called subcutaneous, which means under the skin, and the other is visceral. Visceral means around the organs. And so the biggest concern is, especially with the fat around the organs, this is thought to be the fat that contributes to things like insulin resistance, can increase our risk of heart disease and other medical problems related to excess body weight. And in terms of where people deposit fat, in part, some of that is genetically determined. Some people tend to accumulate more fat in the lower part of their body, other people around the midsection. But typically we see the sort of negative effects of weight when we have more weight around the abdomen, the so-called visceral fat.
Excellent. Thank you. There was also a question about specific diets in terms of, medical conditions such as PCOS or amenorrhea. Any thoughts you'd like to share about that would be great.
Actually, I'd love for you to jump in on this one too, with
Sure.
your experience as a dietitian.
Yep.
Just as an aside, there are certain dietary patterns that may be beneficial to certain medical conditions. So you brought up PCOS. PCOS is commonly linked to insulin resistance. So in this instance, people may be more sensitive to effects of food and their blood sugar. So that's where we might recommend choosing higher fiber carbohydrates, reducing these processed foods, and possibly even emphasizing a little bit more protein and to reduce the carbohydrates. But Julia, I'll have you weigh in as well.
Yeah, absolutely. So, there are definitely some points that, can relate to specific eating patterns and, certain conditions such as PCOS. And that's where too, first off is, having a visit with a dietitian. That's where, we're having that one-on-one meeting together and really having myself as your dietitian understand, your lifestyle, your day-to-day, because that's really, really important to make sure that what we're talking about works within your daily routine. And then yeah, in terms of the diet specifics and eating patterns with something like PCOS, absolutely, I completely agree with you, Dr. Lemieux, and making sure we've got that balance at our eating time and really focusing in on the protein and carbs and all of that. So yes, definitely some specifics that can come into play, that can be important to review. Someone else had a question about kind of along the same topic, of wondering if, Form Health covers or really more so addresses like hormones and hormone health, when you're working with patients, Dr. Lemieux, how you cover that if that
Yeah.
comes up.
Absolutely. So in this type of instance, it will depend on the conversation between the patient and sort of what symptoms they may be having, what sort of hormonal imbalance we're talking about, because there's, many, many different hormones. I commonly see, patients who perhaps have entered into menopause, and that oftentimes is a trigger for weight gain for women. And there's a lot of research that's gone into why is that the case, and how can we offset that. And so that's something that we can definitely explore, more on a one-on-one basis. But in general, what some of the studies have shown related to weight gain in menopause is there is a decrease in lean muscle mass, so people are burning fewer calories. And interestingly, one study came out suggesting that spontaneous activity, so like the amount that someone actually gets up and moves around on their own, actually is decreased after menopause. We don't fully understand why that's the case, but there's definitely, important component to consider there.
Excellent. Another great question. So many great questions today. I love it. One question asks about if someone reaches a plateau, what do you do? What can be done to help with that?
All right, I'll let you answer first, Julia, and
Yep.
then I'll weigh in too.
Yeah,
But I love
absolutely.
that question.
I do too. Such an important one because yeah, I think the first thing too, I always like to discuss, when this comes up is identifying what your weight loss patterns may look like throughout this journey. As Dr. Lemieux mentioned, it's a marathon, right? And so through this journey of weight loss, we can see some people tend to have different patterns when it comes to that piece of the scale. Some people tend to lose and then plateau and then lose and plateau. Other people have different patterns, such as, they may lose and then gain and then plateau and then, kind of continues. So there's different patterns, so I think kind of having a better understanding of what our, pattern with weight loss or plateaus looks like is helpful, just, to understand that. And also, weight fluctuations are completely normal, totally expected. There's a lot of things and factors that can relate to, fluctuations on the scale, whether it be, salt intake, bathroom habits, hormones, a lot of different things that come into play as well. So that's kind of one piece of it, is understanding kind of why that scale may be, doing what it's doing. Also, like Dr. Lemieux, like you were saying, I think really making sure to focus on the non-scale victories is really important. So that can be helpful and I know motivating for many, as the scale's kind of figuring out its own thing. And then I would say from a nutrition point of view, it's really just about having those one-on-one visits and, just kind of reassessing, habits and routines and kind of really digging deeper into, what we might be doing as of lately. And if there's any changes we could work on together that might help in terms of moving that scale past the plateau.
Absolutely. And I think what you've highlighted is that it really takes a personalized approach to this, because there isn't a one size fits all. Oh, yes, when you have a plateau, this is what you have to do, A, B, and C. It really depends on the person. And that's where what I love about what we get to do is we get to know our patients and learn more about their experiences and sort of help them troubleshoot, is there a lifestyle component that we need to work through together and help them figure out, what are the next steps I need to take for myself. But I also want to point out, on the flip side, there are, of course, these like physiologic changes that happen with weight loss. And it's very frustrating because here, you feel like you're doing everything right, but your body's kind of working against you. And when I talk to to patients about this, I explain, from an evolution standpoint, we're not meant to lose a lot of weight. That's how our ancestors effectively survived, but now it really works against us. And so that's where, making sure that, all right, are we optimizing things from a lifestyle perspective? If, we're checking all those boxes, then that might be a point where we say, okay, do we need to use a medication to help, overcome some of the, physiologic changes that have happened that are keeping me at this spot? But I definitely encourage patients, and when we're reflecting on this, what is your overall pattern of weight loss? And is it really a plateau, where we're kind of like, it's like that picture I showed. Are we really staying in the same place, or are we actually making progress? So that's where, like, are your clothes fitting differently? I've had patients say, oh, I'm not losing any weight. And I ask, I'm like, well, how about your clothes? They're like, oh yeah, I'm down 2 sizes. It's like, well, have you been exercising more? And they're, building some muscle. And so there's that balance too. So it's not just the number on the scale, but really takes a very thoughtful approach in this situation, because as I mentioned, this is a point where a lot of people say, forget it, why am I doing this? And we want to prevent that. We want to keep you going.
Absolutely. Fantastic. Another great question about medications. Wondering if there's any long-term side effects of these medications you've shared today.
Yeah. So each medication has its own unique potential side effect profile. And then in terms of, using these medications long term, discussion I have with patients is thinking about how, if you take medication for your high blood pressure, just because your blood pressure is controlled doesn't mean your doctor stops your medication, right? Otherwise, your blood pressure is going to come right back up. And you can think of weight in a very similar way. But what I love about weight loss, and this is why I do this, and this is why I love what I do, is that unlike treating high blood pressure, if I help you lose weight, I could potentially get you off of the blood pressure medication and your blood pressure will still stay down. But if you're treating, just the blood pressure with medication and you stop it, it's going to come back up. And the other thing I do want to point out is that, the long-term, risks and benefits is really a individualized discussion that you have with your doctor to determine, what is the safest and most appropriate next step for you.
Absolutely. Fantastic. Another question I would love to address. Someone asked about the use of low fat or no fat foods versus eating real food, and if those are recommendations that come into play with the team here at Form Health and the dietitians in particular. And so that's a great question. What I would say to that is there's truly no one size fits all. This is all about what works best for each person. And so, if I'm working with someone who has a preference to, consume, no fat or low fat foods and, get their fat choices in elsewhere, then great. I will fully support that if that's what works best for that person. Absolutely. And then other people who, say, oh gosh, no, I really don't want the low fat, no fat product choices and, want some other choices instead that incorporate my healthy fats of sorts. Great. This is really, the thing here is just to know that it's always individualized to each person. And that's really key.
Yeah. And I think it's really interesting, I think it was like the 1970s is where they started this whole low fat trend, because they thought, oh, dietary fat is what's causing heart disease, the number one killer of Americans. And unfortunately, when they did that, we see rates of obesity going up, no change in rates of, heart disease, no beneficial change, let's put it that way. And in part, what we also found is food companies got smart. And when they made these low fat products, they just added more sugar to it and made it less healthy. So it's really about thinking about the quality and less of know this or avoid this in the sense of the broader terms of carbs, protein, and fat. But the quality of the foods that you're eating, I think, is something that we all try to emphasize, with the understanding that we live modern lives. And so maybe expecting someone to have a beautiful home cooked meal of vegetables that were from the garden, like that's not going to happen. So how can we work with you to get closest to ideal as possible?
Absolutely. Fantastic. Well, let's see. I think that is about all of our questions. I know we're about out of time here as well. I want to be respectful of everyone's time too, of course.
Okay. Well, again, thank you all so much for joining us today. I really appreciate all the questions that you asked and for your attention. And we will be sending you a link with the recording of this webinar. You can check out our website as well, www.formhealth.co. And Julie and I would love to work with some of you in the future. If you are interested, please let us know. But otherwise, enjoy the rest of your day. Bye,
Thanks,
everyone.
everyone.